Hello, myself Dr. Preeti Mahawar. I am working as a fertility specialist. Embryo transfer means placing the woman embryos back into the uterus with the help of a small catheter under the USG guidance. It is the final step in the IVF, whereas after giving fertility injections, ovum pickup, fertilization with the sperms, and then formation of the embryos, and these embryos and their transfer back to the woman's uterus. Embryo transfer is broadly classified into two parts: the fresh embryo transfer and the frozen embryo transfer. In the fresh embryo transfer, this is done in the same cycle as the woman receives the injections, the fertility injections. The embryos are formed, they are grown in the laboratory for up to day 3 or day 5. The embryo transfer can be done in the day 3 or day 5. A day 5 embryo is called a blastocyst. Day 5 blastocysts help us in choosing the embryos which one to transfer, and the rest of the embryos are then frozen. In frozen embryo cycle, we generally from the day 2 of the menstrual cycle, we give the woman the medicine in order to make her endometrium grow, and when the lining or the uterus endometrium lining is proper, in that case we start the progesterone supplementation. After the supplementation, she is given a date for the embryo transfer, and on the date of the embryo transfer, the embryos are thawed in the laboratory and then transferred back to her uterus. Endometrium lining preparation, few medicines are given. These are the estrogen containing compounds. These are in a form of tablets, vaginal pessaries, or in form of the gel or the puff. When we find the endometrium lining is proper, progesterone supplementation is started. These can be in a form of tablet and the gel also. These are helpful in making the endometrium receptive. Along with this, folic acid supplementation is also given. These medicines are to be taken very regularly without any failure. There are generally a set of instructions which is given by the doctor on the day of transfer. These are: first of all, keep yourself cool and calm. Take the proper medicine as advised by the doctor. Follow the instructions of water intake as transfer generally happens in a full bladder. Take breakfast as well as lunch and arrive at the clinic in a proper time. On this day also, avoid the use of nail polish and perfume. Generally, single or double embryos are transferred. The number of embryo formed will depend upon the age, the quality and the quantity of the sperm as well as the eggs. In order to avoid the risk of the multiple pregnancy and its complication, we generally advise single embryo transfer. In case there is some medical condition like diabetes or hypertension which can aggravate during the pregnancy, or there is some uterine abnormality, in that case single embryo transfer is generally advisable. It is better to transfer 2 embryos if the woman age is more than 35 or there is a history of previous IVF failure. People generally ask, is embryo transfer a very painful procedure? I said no, it's a painless procedure. It's a very short procedure and even anesthesia is not required. Embryo transfer, the actual process is that you will be taken in the embryo transfer room. You will be asked to lie down comfortably in a lithotomy position, and you will be also in a full bladder. The embryologist will load the embryos in the catheter, and the doctor with the help of an ultrasonography will put slowly the embryos inside the uterine cavity. You will be resting for around 15 to 20 minutes after the transfer. A prolonged bed rest for 15 to 20 days is not required in any case. You can lead a restful life for 2 to 3 days after the transfer. Heavy physical exercises and avoid lifting very heavy weights during these 15 days. After the embryo transfer, she can walk, she can work as well as she can drive also. Going to the swimming pool is little better to avoid because the water contain infection. So in this case, going to the sea or using bathtubs or swimming should be avoided. Diet instruction should be followed after the transfer. It is best to take home cooked food, take well balanced diet, eat plenty of green vegetables as well as take fruits also. Take lot of water also and avoid excessive coffee, alcohol and smoking. After the transfer, slight discharge or blood stain discharge is possible. Please do not worry. Implantation occurs when the embryos attaches itself to the uterus cavity. Implantation is totally a natural process. It depends upon the quality of the embryos and also the uterine receptivity. Success rate of the embryo transfer is around 40%. It depends upon the age, the quality and the quantity of the egg and the sperms, plus why the IVF was required in the first place, what was the indication of the IVF, and what is the duration of the infertility. On an average, the transfer success rate is around 40%. Yes, there are complications which can happen after the embryo transfer. Miscarriage can happen. The rate is same as in the natural pregnancy, and sometimes the embryo is implants in a wrong position like the tubes, which is called ectopic pregnancy. In this case, laparoscopy may be required. Well, it is very difficult to accept that implantation is totally a natural process. Implantation will going to take place if suppose the uterine receptivity is good and the embryos is also good in quality. But yes, there are few steps which can take. One of them is a blastocyst transfer. This is a day 5 transfer and it can improve the implantation rate to some extent. Second thing is the pre-implantation genetic testing. In this, the embryos which are chromosomally normal are transferred back into the uterus. There is something which is called assisted hatching, in which a hole is made in the embryo's wall. So it's help in sticking inside the uterine cavity. If suppose there is some uterine infection, it can be cured. Correcting any uterine infection. If there is a defect in the shape of the uterus, it can be corrected with the help of hysteroscopy. Endometrium receptivity assay, it is finding the window of implantation, and the transfer can be done as following the ERA. Pregnancy test is generally done after the 15 days. We do the blood test which is called beta HCG. The beta HCG start increasing once the embryos have implanted. Actually, there are no signs and symptoms of pregnancy. Some women have a breast heaviness, some can have a bloating, some have nausea or vomiting, and some women have no signs and symptoms. So it is best to continue with their medicines, do the beta HCG and go and report to the doctor.